Assalamualaikum and a very good morning to everyone. I'm Associate Professor Dr. Hazreen from the Department of Social Preventive Medicine. I'm also the PhD coordinator for the department. Today, I will do an introduction to public health nutrition module. And the first subtopic, I will be focusing more as an overview what is about public health nutrition. In this public health nutrition module, there are several components that is essential for any health personnel who would like to pursue or work in the public health field. The three components in public health nutrition that includes applying knowledge to the solution of public health related problem focusing on nutrition, understanding the framework of public health nutrition, and using the evidence to assess all evidence available, and suggesting any possible intervention that can be conducted so that it can be more or cost effectively to be run. The framework or conceptual model that I would like to use today is based on the United Nations Children's Funds or UNICEF conceptual model. In this UNICEF's conceptual model, malnutrition and death can be due to immediate causes such as diseases and inadequate dietary intake. The overall underlying causes for the inadequate dietary intake would be inadequate access to healthy food, as well as the underlying causes for both diseases and inadequate dietary intake include insufficient health services, an unhealthy environment, or inadequate care for both mothers as well as children. The reasons for inadequate care for mothers and children were due to inadequate education both formally and non-formally. What I mean by formally here is to get some knowledge from the institutions. And the basic cause for the malnutrition and death based on this conceptual model would be poor economic structure, limited potential resources, and political and ideological superstructure. For example, in a country where there's always war or they actually have some political instability, the impact towards their health or as well as nutrition going to be seen, because outcome from that normally there will be minimized or inadequate access to healthy food or maybe some sanitations as well. Thus, they will lead to more burden for the country to treat, and thus prevention is very important. For this public health nutrition module, several key aspects will be highlighted, such as nutritional epidemiology, assessment of nutrition status in individuals' population, nutrition for pregnancy and lactation, nutrition in infancy, childhood and adolescence, protein energy malnutrition, and micronutrient deficiencies. We have to understand for the micronutrient deficiencies that is in Malaysia will be differ in comparison to other countries or more developed countries. Nutrition epidemiology that is taught in this course will highlight the skills required for designing appropriate study or conducting nutrition surveillance and development of research protocol. Why is it important? The studies design need to be correct in order for people to appreciate or maybe to use that as a form of evidence for future policies development or even though for future program intervention to be conducted. In this public health nutrition module, for example, nutrition in infancy or childhood and adolescence and the aspect of maternal and child health nutrition also will be highlighted. Why is this important? public health personnel also should understand the energy requirement, for example, for pregnant mothers in the third trimester or the second trimester would be more or slightly more in comparison to female of the childbearing age. This is crucial to understand the importance of achieving optimal nutrient supply at that critical time to enhance growth and maintain function for both mothers and the baby. In this module, especially for these particular slides, the community program of nutrition at the national level and food security or food policies topics will be highlighted. In addition, to make the study more interesting, several hands-on practical also will be conducted. But since this is only an introduction to public health nutrition, the practical would not be conducted now. If any of the students that is going to pursue or take this module separately, the practical will be delivered then. As a public health personnel, in order to understand the depth of public health nutrition, this particular module also offers several seminars that will be focusing, for example, nutritional needs at community level, food safety and hygiene issues, where we will focus either in the hospital level or at the outside level, which is food stalls or within the vicinity of schools, and current issues in nutrition and health, for example, in relation with the increase or prevalence of diabetes in Malaysia might be due to the unhealthy eating habits in Malaysia.